Hello, everybody. So I'm Chris Gayton here with Chris Gayton, MD, and we will go ahead and get started. Thank you for joining us here. And if you have questions, I would like for you to put them in the question and answer box. And the I don't see my chat box is still hidden right now, so please put them in the question and answer box. So today, again, I thank you for joining, and I'm looking forward to talking to you about the top 5 ways that you can fix your hand pain. So these are things that you can do on your own, and they will help you be better prepared for your clinic visit, whether you're seeing me or one of our other hand providers here at OrthoSC. And so the most important thing to know to fix your hand pain is why your hand pain is hurting, or why your hand is hurting. And there are several reasons. We'll go over the 5 most common reasons for hand pain today. These include things like arthritis, carpal tunnel syndrome, tendinitis, cyst, and then also injuries as well. And so on this picture, you can see some crooked fingers that look like arthritis in the fingertips that can cause your fingers to get crooked, things like this. So every day in the office, I see patients who maybe have just retired, and they've started having pain in their hands. It's keeping them from crocheting, or this time of year from doing their garden work and other things that they enjoy doing, being able to get outside and enjoy life. I'll also have patients who complain of pain in their hand with numbness and tingling that may wake them up at night, that keeps them from sleeping well, and then they're more irritable the next day. New moms will get tendinitis. Sometimes new grandmoms will get tendinitis from lifting the grandkids and trying to buckle them into car seats. Other people will complain of pain in their hands where their finger is catching, or they have a bump in their palm that is causing pain, and difficulty with gripping, opening bottles, jars, all those kind of things. So I imagine if you have hand pain, then you probably identify with one of those kind of scenarios. So we'll go ahead and get started with the 5 most common causes of hand pain. And so these 5 things probably cause at least 80% of all the problems that I see in my office. And so carpal tunnel syndrome, we started talking about the trigger finger, which is a tendinitis, and then arthritis and ganglion cyst. So carpal tunnel syndrome is a picture of the nerve getting pinched, and this causes pain and numbness and tingling in the thumb, index, and long fingers, typically. And this can cause cramping, burning, tingling in your pain, a lot of time, or in your hand. A lot of times while you're sleeping at night, you have to wake up and shake out your hand. Or if you're driving and your hand starts going numb, this is usually carpal tunnel related. Trigger finger is a tendinitis, and so this involves pain here in your palm, and the finger can get caught down. You may actually have to pop it open, and this can cause pain and swelling in your fingers. It can also happen in your thumb as well, where the thumb clicks or catches. Thumb arthritis is a little further down the thumb. So this is more at the base of the thumb, where the thumb meets the hand and wrist. And this causes problems with opening bottles and jars. So right here where this frowny face is, this is where people with thumb arthritis have pain. And this is definitely one of the most common causes or common arthritis problems that I see here in the base of the thumb. So pinching, trying to sew, or sometimes with people who are even using their phone for texting or playing their games on their tablet may get pain in this area. And then the next one, a little further up, this is wrist tendinitis. So this is pain where when you're moving your wrist and the tendons are getting inflamed and caught in that area. And so the space for the tendons is a little bit too tight, and that's causing pain and inflammation. And so, and this is what I was talking about. New moms get this from lifting their babies or grandmothers. And then also just from any sort of lifting or repetitive activity. And then the fifth cause, ganglion cyst. So this involves a bump over the back of the wrist or bumps like these over the finger. And so sometimes these will come and go. They may go away on their own and then come back. Sometimes they will actually drain. And if it drains, that's a bigger problem. That's not something you should fix on your own. But if it starts leaking, then you should come in and let us check it here in the office. So this is my website here at chrisgaytonmd.com. And so I've got a lot more information and videos about these 5 common hand problems. I also do shoulder, elbow, and fractures as well, and in addition to the hand and wrist. So rotator cuff surgery or shoulder replacement, these are all things that I take care of. Basically, I will do anything from the hand to the shoulder, from any age, from birth to age 100. And so I did my orthopedic training at Wright State University in Dayton, Ohio, and then did my hand fellowship in Pittsburgh, Pennsylvania. So this was an extra year focusing on the hand to the shoulder and learning all the newer techniques and getting faster and better at performing surgery on the arm. And then I'm originally from Georgia, and so I'm very proud of my Bulldogs being national champions this year. And so it's been a long time coming. A lot of close defeats over the years that have been demoralizing, but I'm proud of the Atlanta Braves and the Georgia Bulldogs as being national champions this year. So on to the promised talk on the top 5 ways you can fix your hand pain. Number 1 is braces. So using a wrist brace or a little finger splint, these things can help. So the idea behind a carpal tunnel brace or a wrist brace is that it keeps the wrist straight and keeps you from bending your wrist and curling your hands up at night while you're sleeping. If you curl your wrist up like that, then that can kink off the blood flow to the nerve, and that causes more pain and more numbness and tingling in the wrist and the hands. So the brace works to keep the hand and the wrist straight, and that helps with the blood flow to the hand. And so the wrist braces can also help when you're on the computer. So when you're on a computer, you want your elbows and your shoulders to be at about 90 degrees. You want to have good posture, good ergonomics to help with work and with pain. And so also getting up and moving around, taking a break can help while you're at work. For trigger finger, these little finger splints can be helpful. You can also use a Band-Aid or a little wrap with taping around the finger joint, and that can sometimes help keep the finger or the thumb from catching. So these braces that I'll show you, we have these here in our office. You can also find them on Amazon as well. And so Amazon's a great resource for sort of all things medical. And so we'd be happy to share these things with you or to kind of point you in the right direction. So thumb braces and wraps come in two basic types. There's a softer wrap that still allows you to bend the thumb somewhat, but gives you some support or can still allow you to bend the wrist some. On the brace on the right side is a more solid brace that keeps you from bending the wrist. And that can be useful for de Quervain's, for the wrist tendinitis that we were talking about. And so sometimes I recommend that patients get both type of these if they're having thumb pain. And so then you can alternate, use one during the day or one at night. So the next way you can fix your hand pain is using heat in the mornings. So warm water, so taking a hot shower before you get up and start your day. That can help to loosen up your joints, especially for arthritis or for trigger finger. So getting a bowl of hot water and soaking your hands and working on starting to get them moving can be helpful. Ice is usually helpful after activity. So after you've been out working or playing golf, then you can ice your hand, and that'll help calm down some of the inflammation. Also, ice before bed sometimes can be helpful if you're having pain at night that wakes you up. So heat and ice, any of these things, some of the icy hot or some of those other creams can be helpful for this as well. And then exercises. So like we talked about, getting up and taking a break every 30 minutes to an hour or so if you're working on the computer, if you have a desk or office type job. These exercises are called tendon glides. So this helps getting the fingers moving and the tendons moving in different directions. These are really important after surgery. So you want to make sure that you get back to moving your hand, or after an injury, after a fall, after any sort of fracture or sprain. You don't want to let your hand get stiff, or you don't want to wait till the pain goes away to start moving it. You want to start trying to move it right away, because the more you can move it, the more you can make a tight fist, the more that's going to help the swelling and the stiffness go away. And so the hand works as a pump. And so the more you make a tight fist, squeeze it, hold it for 20 or 30 seconds, then that will help get the swelling down like we were talking about. And so as I'm sure a lot of you know, with arthritis, the more things get stiff, the harder it is to get them back moving every morning. It's kind of like you're starting over with stiffness. So you really want to keep things moving. We say that motion is lubrication for your joints. And so really try to keep moving. If you use it, then you lose it. Or if you don't use it, you lose it as far as motion goes. And then exercises can be helpful for carpal tunnel. These are nerve gliding exercises. So basically you're stretching your wrists back and then straightening out the fingers, doing some rotations, and then also pulling on the thumb. All those things kind of help get the median nerve and the wrist moving with carpal tunnel. And these have been shown to help calm things down and to give the nerve time to recover. Because a lot of times the tendons get inflamed around the nerve, and that's part of what's causing pressure around the nerve. So if you can get that inflammation down, then that will help with the pain. Next up, I have anti-inflammatories, NSAIDs, and Tylenol. And so you'll notice that I put this farther down the list because there are some risks with these medicines. For the anti-inflammatories, Advil, Aleve, these can upset your stomach. And there are also some heart risk if you are taking them for a long period of time. Tylenol can cause problems with your liver if you take high doses of this for long periods of time, or if you take multiple pain medicines or multiple medicines that are included that have Tylenol in them, then you can do permanent damage to your liver. So you definitely don't want to go over the recommended amount. And you also don't want to combine two types of anti-inflammatories. So Advil and Aleve, you can't take those together. You don't want to take aspirin and Aleve or aspirin and Advil. But you can combine Tylenol with one of the anti-inflammatories. And so the combination of those works well for patients after surgery, to where a lot of times we can avoid giving out pain medicine or narcotics after surgery. So most patients who need a carpal tunnel surgery or a trigger finger, one of the other tendon surgeries, they don't even need narcotics anymore if they do the combination of those Tylenol and ibuprofen. And then Voltaren is a prescription strength pain reliever that's a topical gel. So it's like an ibuprofen gel. And so then you can put this on the places that hurt. There are other topical things that patients like. So like we mentioned, Icy Hot or Blue Emu or any of those topical pain creams. And so basically it's whatever works as far as this. Vitamins that help with arthritis, if this works for you, then great. If it's not really working, then I wouldn't continue to spend the money on it. And then probably the easiest thing or the simplest thing, I guess, to do to help with your hand pain is to work on your diet, your sleep, and also getting general exercise. So your overall fitness and health level. Working on getting your blood sugar under control if you're diabetic, and that can really help with your overall pain and overall inflammation in your body. So I say this is simple. It's definitely not always easy to eat healthy when you're on the run, or if you're busy with kids or work and everything, to get enough sleep. But trying to make it a daily habit to get some exercise, this is very important for, like we said, increasing blood flow and avoiding other cardiovascular problems. And diabetes makes all of these hand problems worse and also puts you at higher risk of infection. So you definitely want to try to prevent and avoid diabetes. So avoiding sugar, avoiding processed food in your diet, avoiding eating out too much. So one of the simple tricks or habits that you can start right now would be getting a 16-ounce glass of water and starting to drinking a glass of water the first thing you do when you wake up in the morning before you do anything else. This helps just keep your body hydrated after not drinking anything all night. And if you like coffee, then that dehydrates you. So trying to drink some water before you do your morning coffee, then that's helpful as well. And so water helps flush out the toxins and some of the inflammation from your body. And so it's very important for health. And then as far as diet and exercise go, your diet is far more important than your exercise. So exercise is probably 20% weight as far as importance, and your diet is about 80% of the importance. And so you can't out exercise a bad diet. So you would have to exercise all day long if you're eating McDonald's or other fast food every day to try to counteract the amount of calories that can be packed into some of these the treats that we love on occasion. So you want to eat the sugars and processed foods very sparingly. Maybe have one cheat day a week where you treat yourself, but otherwise limit this to fruits and vegetables, healthy, non-processed foods. And so the bonus ways that you can help fix your hand pain, if these other 5 ways don't help, or you're still having, they help somewhat, but you're still having some problems, cortisone injections can be helpful. So cortisone is a steroid, and so we can inject that in the places where you're having pain. So in the carpal tunnel, along the tendons for the trigger finger, in the joint for arthritis or for tendinitis. Sometimes with cysts, we will inject them as well, or try to drain them, and that will help them go away. And then therapy can be very helpful, very beneficial. We have therapy here in our office at OrthoSC. So if you're not able to do the exercises, or you're not motivated enough to do it on your own, or you need some more guidance, then working with one of our trained therapists can be very helpful. And then lastly, surgery is probably the ultimate fix for a lot of these problems. So carpal tunnel syndrome can sometimes get better, but especially if you're over the age of 60, if you're having numbness and tingling in your hand and it's carpal tunnel, then you're probably going to end up needing surgery. So the cortisone injections can help, but they're usually not a permanent fix for something like carpal tunnel. For some of the tendinitis and other problems, they can definitely take care of it for good. And so this is our office here in Conway at OrthoSC. We're in the Medical Arts Building at the Conway Medical Center. So we're on the 3rd floor. We have the whole floor up here to help take care of you. And so we'd be glad to see you here in the office to schedule an appointment if you're continuing to have problems, or you're still not sure what's causing your hand pain. So this slide is the typical recovery after surgery. And so you can see how patients have a wrist fracture or have carpal tunnel, they start off with a higher pain level. So the normal population would be down here below the 20 line, so around 15 or so. And so if you have carpal tunnel, then your pain level is typically about a 50. If you have a broken wrist, then your pain level or function is limited to about up to like a 75. And so you can see how after surgery, the pain gets better by about the 3-week mark, and then the 6-week mark, and then it continues to improve up to where by about the 3-month mark, most people are back to their normal activities and back to the same as the normal population. So that's about how long it takes for a broken bone to heal and to start getting your strength back and getting back to normal use. For carpal tunnel or trigger finger, for these tendon problems, you're back moving it right away after surgery. You just kind of have to take it easy while the stitches are in until you can get your strength back and moving it. And so that's what I have for you today as far as questions. So I'd like for you to ask your questions, to put those in the chat box or the question box now, and we'll go over those things. And then please like and share this on my Facebook page at Chris Gayton, MD, and then we'll try to do more of these webinars and more of these videos for you to be able to see, to be able to help prevent your hand pain. So I'll start off with these questions. It looks like we have 7 starting right now. And so the first one is from Jack. and says, I have had sagittal band surgery. My hand gets stiff and sore across the top of my hand. What can I do to lessen the pain and stiffness? So, after sagittal band surgery, this is where the tendon over the back of your hand is popping. And so you sometimes it doesn't stay on the top of the mountain over the bone, and the tendon will slide off into the valley between the two bones. And so to start with, you need a splint to kind of keep it straight. But after it's healed enough, then you really want to start working it and trying to get your motion back. Therapy is usually required after a surgery like that. And but like we were saying, keeping it elevated as much as possible, icing it, and working on your motion. So doing squeezes, you can use the other hand to start pushing it down to work on trying to get your motion back. The next question is from James, and he says he has what is commonly known as Viking's disease. And so this is called Dupuytren's disease or Dupuytren's contracture. And so this is where your hand, typically it's the ring and the small fingers are most commonly affected. And the fingers can get pulled down by a cord of tissue that connects your skin to your bones. And this is most commonly people of Northern European heritage, and it's genetic. Unfortunately, there's no cure for it, but there are treatments. And so I actually just treated a patient today for Dupuytren's disease, where we did an injection into the cord, and then we bring the patient back a couple of days later, and that injection helps dissolve the cord. And then we can stretch the finger out and break the cord, and that allows the finger to straighten out again. Jill posted or asked about getting a copy of these exercises. So absolutely. So this talk will be online. I'll put this on my YouTube channel at Chris Gayton, MD. And then we will also do it on the OrthoSC website as well. And then these exercises, if you Google tendon glides or carpal tunnel exercises on YouTube, you can find a lot of these things there. And so we'll try to maybe make some videos or have some of the therapists make some videos for things that you can start working on as well. Wayne says, I take a baby aspirin daily. Can I take Advil for pain? And I would say that's probably okay, but you may want to talk with your primary care doctor and see if they're okay with you taking that. So aspirin and anti-inflammatories can kind of thin your blood somewhat, and so that can cause some problems, can put you at a little higher risk of bleeding if you're taking multiple types of anti-inflammatories. So another question, it's my understanding that hypothyroidism can also contribute to hand and wrist arthritis as well. So hypothyroidism can contribute to carpal tunnel and to your general overall well-being. Your thyroid system is part of your endocrine system, and that helps control your fluid balance, your electrolytes, all those different things. And so, yes, hypothyroidism can affect your joints, and I'm not sure the exact link with arthritis as far as that goes, but that's something that I'll try to look up and read some about. That's an interesting question. Next, Susie asked about when does it become necessary to replace the PFP joint of an index finger that has bad arthritis? How long does it take to recover, and how long will the new joint last? So finger joint replacement is a great surgery option for finger arthritis. If you've gotten to the point where cortisone injections or the topical pain relievers aren't working, if your finger has gotten very crooked to the point where it's crossing over one of the other fingers, and it's keeping you from doing the activities and the things that you want to do. So usually the surgery is outpatient. You're in a splint for the first 6 weeks or so, and then it usually takes about 3 months to get back to normal uh, motion and strength. And so with any big hand surgery, I always tell patients it takes about a year to get as good as you're going to get. So by 3 months, most patients are happy and they've kind of graduated from seeing me, but they will continue to improve their strength and their motion for that year mark. And so these joints can last forever, basically. Usually, you don't need another surgery for it. So it usually lasts for as long as your life, but occasionally they do have to be changed or be revised. And so if you start having increasing pain or notice a problem, then it's worth getting it checked or getting another x-ray. The next question is on cortisone injections for arthritis. How often can you get the injections? So my rule is usually every 3 to 4 months you can get the injections. And as long as they're not causing problems with the skin or the tendons, if you have a joint that has bad arthritis, then you can continue doing the injections. But sometimes they can cause problems with the skin getting thin or changing the color of the skin. So there are definitely risks to some of the tendons and some of the other structures with doing repeated injections. The Jody asked about using a tension ball to strengthen your hand and thumb. And so, yes, a tension ball can be good for strengthening. After surgery, it's really important not to use a tension ball or a squeeze ball, but to really work on getting the tight fist. So the therapist a lot of times will use what's putty or a clay. And so they'll work on having patients squeeze that so they make sure that they get their hands all the way down, and they'll use that to strengthen the hand. But after you can get your motion all the way back, then you can use a squeeze ball, or some people will use a rubber band to stretch out and to work on uh, getting the fingers out, getting some strength back there. You can start using weights or resistance bands. So for exercises, you can use whatever you have in your house. So you can use a can of food, or you can use a jug of milk, a gallon of milk, to start off with it light. So just fill it up with a little bit of water and use that to grip and to hold and do exercises with your hands. And then also light 1 to 5 pound dumbbells are great for your hand as well. And so these are very affordable at Walmart or one of the other sporting goods stores for some light dumbbells. You can also use a resistance band that can be helpful. The next question, Grant asked about what's your experience with turmeric or boswellia for hand arthritis? I do have some patients who think that turmeric helps. Some people think glucosamine or chondroitin. There's some new research on vitamin D is being used for arthritis. Vitamin B6 has been shown to be helpful for nerve problems. So I do think there's a lot to eating a healthy, balanced diet of fruits and vegetables that can be helpful. And I'm not familiar with boswellia. So that's another thing that I would have to look up or to do some more research on. But again, if it helps you, then I think it's great. If it doesn't help, then so try things out for 2 to 4 weeks, and that usually gives you a long enough time to know if it's really making any difference. And then so sometimes it's important to try things or do things for a month and then cycle it off or take a break for a month or so. Jill asked, I worry if I'm making it worse sometimes. I fractured my wrist. I'm doing well, but I don't know how far to exercise my wrist. So again, that's a question of how far or how long it's been since surgery. So once the bone's healed, basically you're not going to do any damage to it by pushing it. But if you're doing things too early, if you're trying to do handstands or lift or push or pull too early before the bone is healed, then there's a small risk of doing some damage to it. But usually after 2 months or so after the injury, then it will, as long as you don't fall on it, then things should be fine. Um, Frank asked, I'm a piano and keyboard player, and after 40 years, I have some hand numbness and pain with trigger finger in my ring finger. I've continued playing for 4 hours or more, a couple nights a week with practice. Should I try to limit my playing? Would it get worse as I play? Or what should I do to help while playing? So for trigger finger, if it's continuing to cause problems, a cortisone injection may be helpful to try to help take care of that. Sometimes the shots will take care of that for good. And then I've started trying to learn the piano and try to start playing that again recently. And I'm a average intermediate, I guess I would say. And so just trying to take a break between songs and doing some exercises, stretching out your hands, I think could be helpful. Sometimes I'll recommend for patients who are playing golf with arthritis or things like that to take Advil or ibuprofen before you go play. And that may be helpful so you can get through the round or through the gig for those 4 hours. And so as far as another thing to look out for carpal tunnel syndrome, you don't want to let it get too bad. So if it's getting to be numb all the time, if you're noticing more weakness in your thumb, then those are reasons to check out or signs that the carpal tunnel is getting bad enough that it probably will need surgery. Okay, another question. Can you explain the cause of sharp stabbing pain on the outside of your wrist, kind of the pinky side, when striking a golf ball? So this is definitely a common type pain with golfers, and this involves the cartilage, usually on the ulnar side of the wrist, so on the pinky side of the wrist. And so with an impact of a golf swing, this can cause some pain, or you can have a tear of the cartilage there. And so wraps can be helpful for this, and sometimes an injection in that area can be helpful. And sometimes we will actually go in with a camera to look on that side of the wrist if it's still not getting better, to kind of clean up the cartilage. Sometimes the cartilage will need to be repaired, and that's called a TFCC tear, and a wrist arthroscopy is the surgery for that. Greg asked about what exercises are good for thumb arthritis. And so for thumb arthritis, so working on your motion, so finger taps, so to try to keep the thumb and the fingers moving can be helpful. And then those rubber band exercises to stretch the thumb out, again, like the clay or the Play-Doh can be helpful to work on your pinch and your strength. And then our therapists are good with these. So a brace and therapy has been shown to be helpful for thumb arthritis. Thumb arthritis is very common. Probably 75% of us will get thumb arthritis at some point as we're getting older. But definitely not everybody needs surgery. So if you can get the pain to calm down or kind of get through the flares, then a lot of times it will get better over time. All right, so next question. I have a prescription for meloxicam, and it does help with my finger arthritis. How long can I continue to use it? So that That's a tricky question, or can be kind of like the $1 million question. We never know exactly what's going on inside. So I would say for any of the anti-inflammatories, it's important to maybe use it for a week or two, and then try to take a break for a week or two if you can. That'll give your stomach lining some time to calm down. Some of the meloxicam is also known as Mobic, and it's similar to Celebrex if you've taken that before. And the and those can be good. There are risks to your heart, and so you want to talk with your primary care doctor. And you may want to get some blood work done to check your kidney function or your blood pressure if you've been on anti-inflammatories for a long period of time. Um, and so I think those are all the questions that I have right now. Lisa, I don't know if you're available. I still can't see the chat box at this time.
Give me just a moment. I'm going to send them over to you.
So while she's sending those, again, my website is chrisgaytonmd.com, and you can go there. You can schedule an appointment directly from that website. There's a box at the top that will take you right to our scheduling center, and you can see when our next available appointment is. And then also at Chris Gayton MD on Facebook. So I share some videos there. And so if you have questions, please post them there, and we can try to get you some answers as well. And so for a lot of these things, like we talked about, these 5 ways that you can fix your hand pain will help and improve your pain. It may take care of it for good, and you may not even need an appointment. But for other people, this will help your pain, and so you may still need an appointment. And like we said, some people may end up needing surgery. So wherever you are, we'd be happy to see you. And I think Lisa just sent me the chat questions. Let me take a look, see if I can read these. So I am age 64. I'm definitely not able to use my dominant hand and thumb as much as I had when I was younger. I'll consider a brace, as you showed earlier. Is the tension ball worth using? And I think we addressed this this question. And another one, I have basal thumb arthritis that you've diagnosed, and I use Voltaren as well as Advil and Tylenol at times. I've found there are times when my strength is minimal and I can't open a jar or tear open a packet. It's frustrating for sure. I know this comes with age. And so pain can definitely limit you as far as your function. And so using the hand to keep working it, to try to keep your motion down. And then an injection for the thumb joint can be helpful. And so unfortunately, as we get older, you do end up losing some strength. And that's why exercising or doing resistance exercise are important, to work on maintaining your strength, maintaining your bone strength, to help prevent osteoporosis. So you want to get some sort of resistance exercise at least 3 to 5 times a week. And so getting some resistance bands to work on your muscles, weight bearing exercises. So you can do body weight, you can do squats, and those can be helpful. And then like I said, getting some milk jugs, using those, and to fill up with water, to lift those, to do some presses, any sort of things like that will help build your bones and help prevent you from being at risk for a fracture. All right. Jill said, thank you for doing this. I would say thank you for coming. And Frank asked, what's your opinion of oral diclofenac pills as an anti-inflammatory, or do you recommend something that might work better? I think I don't have experience with taking diclofenac. I know my mom took it for her hip arthritis, and she thought it worked well for her. And so I will prescribe this some. And so again, this is something that you want to talk with your doctor if you're on it for long periods of time. Just be careful with your stomach and your kidneys, your blood pressure, those sort of things. I think any anti-inflammatory can work well. And so basically it's important to use whichever one works well for you. I know some people like Advil or ibuprofen better. Some people like Aleve better. And so those are both options for you. And then we asked, there was another question about Dupuytren's contracture. We talked about that a little bit as well. That was the contracture where it pulled your finger down. And sometimes it can affect your thumb. That can cause nodules in your hand. And then for some of these procedures, we can do the surgery even in the office, so where you don't need anesthesia. And so commonly for like a trigger finger or for some cyst, I'll do these a lot of times in the office. If it's something more complicated, then usually we do it at our surgery center in Carolina Forest, and they do a great job there. But for the office surgeries, what we do is we inject numbing medicine into the area. And so that makes the whole finger go numb for about 6 hours. And then we can do the surgery. You're awake. We put some music on for you. And then we'll do stitches in that area. And then you're a bandage that stays on for about 5 days. And then you're kind of taking it easy, like we said, and then doing, and then we see you back and get the stitches out and start getting you back moving it and using it and doing things with it. So we're hoping to post a video of one of the surgeries that we do in the office to kind of show you how that would work and what that's like. Another question, do we have hand therapy in the office? We do have hand therapy here in the office. And so we have Maureen and Madeline are our therapists, and they do a great job. There's one of them here every day in the week, and they're here with me in the office on Tuesdays, Thursdays, and Fridays. And so that way, if you've seen me, then sometimes we can get you over to see them the same day, and they can get a brace made for you. Or if you're having a problem, they will let me know, and then we can walk over and check you and see you. And so that's a great asset to our practice to be able to work with the therapist one-on-one like that. And so they do a great job of getting you better faster. Okay. Are there any other questions or anything? If not, we'll go ahead and start wrapping up. But I'd like you to just imagine what you could do if your hand pain wasn't limiting you. And so just think about the activities that are limiting you or that are keeping you from doing what you want to do. And so if you would, please share this with someone in your family or with one of your friends, people at your church or your other areas in your community. And then please let us know what you thought of this. Give us any feedback, any things that you'd like us to discuss more in the future. And we'd be happy to try to do these a little bit more often if they're helpful, and also work on some videos that we can post that you can consume on your own time. Okay. Well, if there are no other questions, I hope everybody has a good evening, and thank you again for coming. And we'd love to see you here at Ortho SC. And everybody have a good night. And so I wore my Masters shirt for the golfers in the crowd. So hopefully everybody can watch a little bit of the Masters and enjoy the beautiful flowers and scenery there. All right. Have a good night. Thanks for coming.